Yes. Yes.
I'm not surprised.
Good morning, everyone. Hi, my name is Dr. Rosara Verdes. I'm a physical therapist here at Home and Rehab in Ocoee. I'm generally like just a physical therapist, not just a physical therapist, but yes, I do like treat different parts of the body. But some physical therapists tend to expand and look into pelvic floor as well. I was one of those physical therapists. In PT school, I took a pelvic floor class and learned more about the bladder and bowels and how important it is and how functional it is. And it's a subject that's like overlooked or underlooked, one of those words. But basically, people don't really pay too much attention to it because of embarrassment, or they just don't like talking about it. So that's why I love it, because when patients come see me, they're always like, I never talked to anyone about this. This is so embarrassing. But it's nice that they have someone to talk about the issues that they're having. So today I'm going to talk about two topics. So the first topic is called stress incontinence, and the second topic is called urge incontinence. Incontinence basically means you cannot control your bladder, so you're leaking. So both of these topics means you're leaking in some way, shape, or form. But the first one, which is called stress incontinence, so think about it, stress, something's happening in your body, you're jumping, you're sneezing, then you leak. Then you have urge incontinence, which means I have to run to the bathroom and I can't make it and I pee. Both of them means you can't control the bladder, so you're leaking. The first one, which is called stress incontinence, is more so linked to basically your pelvic floor muscles being weak. So think about the pelvis as like a bucket. So this is the bucket. Everything you see red is a muscle. So that's why, as physician or like clinicians, because occupational therapists can be pelvic floor clinicians as well. But basically, that's why we can help with it, because this is all muscle. And you guys know physical therapists, we can help with the muscle in the arm, muscle in the leg. So if there's muscle in the pelvic floor, we should be able to help as well. Okay, so yes. So the first one, like I said, stress incontinence, which basically means with stress or with exertion, you leak. That means your pelvic floor muscles are weak. So you want this to be strong to basically protect the bladder, because the bladder is here in the pelvic floor, and your muscles are weak. Of course, when you jump, when you sneeze, water is going to leak out. So that's the first one. Urge incontinence, which means like I have to run to the bathroom, I can't make it. People kind of like to think of a term called key in the door syndrome. So as soon as you put the key in the door, you have to pee. The bladder is very, very smart, very, very, like if you pee just in case, the bladder's gonna be like, okay, let's just pee every single time we need to pee. When it comes to urge incontinence, you really have to retrain the bladder. It could be that your pelvic floor muscles are weak, but it's a lot of training. It's a lot of, okay, what am I drinking? Am I telling myself I don't need to pee right now? My body's just telling me I need to pee, because you've trained your bladder to pee. I always tell my patients, do not pee just in case. I know it kind of sounds like counterintuitive, like, okay, like I have to take this long drive, I have to pee. I'm that person that if I'm taking a road trip, I am not peeing just in case. I will stop and pee just because I don't want to trick my bladder. Yes, there are times that you like, okay, I have no choice. There are times I have no choice, I do pee just in case. But if I'm on a road trip, I will not pee. When I'm getting in the car, I'll wait to the nearest stop, and I'm okay, I'm gonna pee when I see the next stop. Which is kind of difficult because you also don't want to strain the bladder as well. But for me, I'd rather not trick my bladder and hold it as long as I can than to just pee just in case. Okay, so those are the first two topics.
What was it? Key? What did you say?
Key in the door syndrome.
Key in the door.
So some people also, they pee in the shower. I pee in the shower. That's out of your control just because the water is hitting you, so it makes you pee. It happens. You're peeing in the shower. Like, I'm not going to tell you to hold your pee in the shower. But some people, as soon as they see the toilet, they pee. That happens to me sometimes. So I don't leak, but I do have certain signals that make me want to use the bathroom. But I just try to train my bladder to not pee if I don't need to pee. If I literally just peed an hour ago, I shouldn't be peeing again. Because the normal bladder should be able to hold urine for 2 to 3 hours. If we're drinking a lot of water, that's different. But 2 to 3 hours is key. I drink a lot of water, even me as a physical therapist. I'm out and about, I'm moving from patient to patient, but I still try to drink water. Like if I'm hydrated, I'm peeing every 2 hours. So that's what you want. That's how you want the bladder to be trained. Any questions on that before I move forward? Okay, beautiful. We went over the anatomy. There are 3 layers of the pelvic floor. The first layer is what you see here. So that's basically the urethra. You'll see like basically the opening of the vaginal canal. That's the first layer of the pelvic floor. Then you have the second layer of the pelvic floor, which is in here. I don't think the third layer is I don't think you will see the second layer, but you see the third layer. This is the deepest one. But you have the second layer of the pelvic floor, which is where bladder and rectum are. That's really, really important because you want that layer to be strong, because that's the layer that's holding rectum and bladder. Then you have the third layer of the pelvic floor, which has deep hip muscles. Those are really important as well. Some people also like to consider the third layer of the pelvic floor also like your deep core muscle or your diaphragm or your muscles in the back, because those are really important for the pelvic floor. If you think of the pelvic floor like a hammock, so this is a bucket or a hammock, if you have the transverse abdominis, which is a deep pelvic floor, or a deep core muscle, which is like here, we like to call it the pocket muscle, your diaphragm, muscle number 2, your multifidi, like really tiny muscles in the back, think of those muscles like a pole holding up the pelvic floor. So people always ask me, I had a patient ask me yesterday, she goes, why are you looking at my core? Why are you looking at my diaphragm? Those muscles are really, really important for the pelvic floor. You want those muscles to be strong to hold the pelvic floor. It's all connected. So that's the second layer. We talked about second, we talked about third layer. So this is the anatomy. Any questions on the anatomy of the pelvic floor? Okay, beautiful. All right, we talked about anatomy. We talked about stress and urge incontinence. So when it comes to stress and urge incontinence, it does happen a lot after childbirth, just because a lot is going on in the body when you're pregnant and after birth. There could be a lot of straining going on. There's a child literally living in your uterus. So a lot can happen after childbirth. So women tend to have leakage after childbirth, menopause as well, because your body's going through a lot of hormonal changes. So some people tend to leak after menopause as well. And then weight can also affect the pelvic floor, because if there's more weight to hold, then that's extra pressure on the pelvic floor, extra pressure on the bladder, which can cause leakage. Not saying that, just because you're overweight or you weigh this much, then, you're more at chance or at risk for it. It's just some people, if they tend to weigh more, it's just more pressure. Pelvic floor PT can help with that as well. And then, let's see. Chronic cough, patients that cough a lot or have some kind of pulmonary issue. Pulmonary just means lungs. They probably tend to leak because they're always coughing. Because think about all that pressure that's going on in your belly and in the pelvic floor. It's literally pushing down, causing leakage. So if you have a chronic cough, that can cause leakage as well. And then certain medications as well can also cause leakage. That's why it's important to ask doctors, yes, when you go into the doctor's office and they prescribe you medication, sometimes they're busy, they're not telling you the side effects, but it's nice to go home on your own as well and do research. Okay, can this cause me to leak? I've never leaked before. Why am I leaking now? So that's obviously a question you have to talk to your medical doctor. Me as a pelvic floor PT, all I can do is strengthen your pelvic floor and look at what else is going on in your body, but medication can also cause leakage. Okay, so if you were come to see me, I would assess you and see how your core is doing, how your back is doing, how your hip is doing. Also, some pelvic floor clinicians do internal work. So basically what internal work means is that we are going in through the vaginal canal, looking at how those muscles are feeling. Not all clinicians do internal work. I like to do internal work because I like to see how the muscles are feeling. Is your pelvic floor muscles tight? Are they weak? How is your strength of your pelvic floor? When a pelvic floor clinician goes into the vaginal canal, we are testing the strength of your pelvic floor. So when we are going in and we're putting one finger in, it's just one finger, one digit, we're able to test that strength. So it goes like a scale, like from 0 to 5. Okay, if it's on the weaker end, that would make sense why you're having leakage. As for me, I also go to a clinician for pelvic floor. My pelvic floor muscles are really, really tight. So I'm a person that I would not benefit from what someone would call as Kegels, so doing a pelvic floor muscle contraction. But that is how we test the pelvic floor. So internal work, that's what it would consist of, us checking how the muscles are feeling and how your pelvic floor strength is. Any questions on internal work? Yeah, like I said, it's not mandatory. Some clinicians, patients do get better without a clinician even going in and seeing how the strength is. Because it's all, like I said, it's literally a bucket and a hammock. We can work on core strength, we can work on back strength, we can work on hip strength, and patients still see benefit from pelvic floor PT even if internal work is not done. Okay. And so when you go to your GYN, they're going more into the cervix. Us clinicians, we're not going that far deep into the pelvic floor. The third layer does not hit the cervix, so we are not going that deep. Some patients tend to be nervous, like, oh, is it like my GYN? It's not, because we're not going in that deep. Any questions? Okay. Let's see. Okay, so we talked about what it would consist of if you came to pelvic floor PT. So yes, when we come in, we will work on core strength, breathing strategy, because like I said, it's literally the pressure in your belly that we're working on. Because if you think of think of it like an elevator. If this is my pelvic floor and this is my diaphragm, the diaphragm is right underneath the ribs. You don't want it to clash. When you're breathing incorrectly, or you're not trying to contract or work the core muscles effectively, everything will clash. So what I like to tell my patients is, okay, we try to exhale on the effort, because when you're exhaling on the effort, everything is coming up, because you don't want it to clash. Does that make sense? Kind of jumped all over the place there. But yeah, you just want you want the pressure in the belly and in the pelvic floor to just work effectively, so that it's not, because you just don't want it to not work like an elevator.
Okay.
If that makes sense. Because think about the pressure, if like it's going opposite direction, and that can cause other things. So that's why it's important to think about that when you're exerting yourself, or when you're going to the gym, or when you're peeing, or when you're pooping too. You want everything to be relaxed, because if you're peeing, everything should be coming down. So my elevator, everything should be going down. If I'm not peeing, if I'm working out and I'm exerting myself, everything should be going up. My diaphragm should be going up. I should be exhaling. Any questions? Okay. Let's see what else I have on here. Okay, so I guess what I would tell a patient, I wouldn't give anyone any specific exercise, because like I said, some people benefit from Kegels, some people do not benefit from Kegels. And like I said, a Kegel is basically a pelvic floor muscle contraction, is what people would consider literally where you're like trying to stop urine, or you're squeezing those muscles. So some patients do benefit from it, some patients do not. So that's why I wouldn't tell anyone like, okay, this is a specific exercise to do at home if you feel like you're leaking. What I would say is probably when you're peeing, like that's a really important tip. Really try to relax when you're peeing. When you're pooping, really try to relax when you're pooping. Don't strain yourself, because that can mess with the pressure within the belly and in the pelvic floor. That's a really important tip I would give someone. Another important tip I would give people is think about the bladder irritants. We don't call them, they changed the term to bladder irritants as opposed to, it was something else that used to be called before, but think of it, okay, if I drank caffeine, my bladder would be irritated. I'm gonna pee more, We shouldn't be leaking if we're having caffeine, but you tend to run to the bathroom more. So think about that when you're drinking caffeine. When you're drinking anything citrusy, so oranges, strawberries, any red fruits, tomatoes, think of that can irritate the pelvic floor as well. So like, okay, I had tomatoes this morning, my bladder feels really irritated, it feels really heavy, or it just feels off. Some patients like to say, it just feels off today, because I'm one of those people. When I drink caffeine, or if I'm drinking anything like carbonated as well, my pelvic floor just feels off. Alcohol too. My pelvic floor does not like alcohol. Some people to stop drinking alcohol too, which is okay. Like there's other ways to enjoy life as opposed to alcohol. So people tend to feel irritated with that. So we talked about citrus fruits, we talked about carbonated drinks, we talked about caffeine, and then cocktail. So think about it like the 4 C's. Those are the things that would irritate the pelvic floor. When patients come in, I don't tell them I want you to stop drinking caffeine. I just want you to be more mindful of it. If you are having coffee in the morning, have it with water. So you're like, okay, sip of coffee, drink of water, just so that you're like making sure everything's balanced, because water is really, really important for the pelvic floor. It helps with the digestive system. It's helping to have it move everything out. Because think about it, if you're more backed up, you're not pooping, then that's going to affect the pelvic floor as well, because your rectum is in the pelvic floor. So that's a tip I would give patients. Be mindful of what you're drinking every single day. If you are drinking caffeine or soda, drink it with water. Or if you are like drinking 2 a day or 3 a day, try like cutting it down to maybe 1 a day. Or even like I said, I want my patients to enjoy what they love to do, what they love to drink. It's in balance. It's in moderation. It's just trying ways to just protect the pelvic floor better. So that's a tip I would also give patients. Another tip I would give patients, don't pee just in case. Do the best you can to try to hold that urine in, because like I said, the bladder's very smart. If you felt like if you peed 30 minutes ago and you're peeing again, the bladder's gonna be like, okay, I'm going to pee every 30 minutes. Peeing every 30 minutes is not normal at all. No matter how much I wouldn't even say even how much you're drinking, how much soda you're drinking. Every 30 minutes shouldn't be. I wouldn't consider that normal, because the bladder's not even full yet. Because you want the bladder to be completely full so you can empty it, so that it knows when it's full, that's when I need to be empty. Not when I'm halfway full. But like I said, caffeine can irritate it, so maybe it could be more irritated having you pee every 30 minutes with those 4 C's that I talked about. But I would definitely say not to pee just in case. Being mindful of what you're eating, what you're drinking. Mostly what you're drinking. Eating, that's a different topic. But that's probably another tip I would give patients. Just like a very basic, you haven't seen a clinician, you haven't seen a pelvic floor clinician, you don't really know what's going on, but you feel like you are leaking. Okay, let me be more mindful about what I'm drinking. Let me be more mindful of if I'm actually emptying my bladder, or if I'm just going to the bathroom because I want to go to the bathroom. So those are the 2 important tips that I would give. don't know if that was 2 or 3. Either way, that was a lot of tips. Yes, Katie.
How about at nighttime?
Mhm.
What's like a normal amount of times to have to wake up?
1 time, 0 to 1. Especially when you're older, 1 time is normal. Me, as a 30-year-old female, I should not be waking up in the middle of the night to pee at all. But around, I'm not sure what age, please don't quote me on that, but older women waking up 1 time in the middle of the night is completely normal. It shouldn't be more than 1. So when it comes to that, I would say being mindful of what you're drinking before going to bed. Maybe you're drinking something that's irritating the bladder before going to bed, causing you to have to pee multiple times. It could be pelvic floor muscle weakness as well, causing you to have to pee so much in the middle of the night. I did have a patient that was peeing multiple times in the middle of the night, and we just talked about, okay, like, because she's also on different medications as well. We talked about her medications, what she's using, you know, in regards to her bladder. What is she doing before bed? Is she telling herself right now, I have to pee, I need it, like, do I really need to pee right now? Or can I just go back to sleep? And then she eventually, I think hers, it was like probably 3 times a night, and now it's 1 time a night, just through education. Education is super, super important. Someone asked me yesterday, like, what pelvic floor PT consists of. It's a lot of education, because a lot of things we don't think about, you know, a lot of things you're not, okay, what am I drinking today? What am I eating today? Or, you know, am I just going to the bathroom just because I want to go to the bathroom? So it's a lot of education. You have a question?
Yes, like you said about the pee, just in case, right? Sometimes I pee. Sometimes even if I have like a very little desire to go to the bathroom, if I don't go, I know sometimes if I cough, I'll pee. So that's why I go just in case to be completely empty. You know what I mean?
Yes.
So that's why I feel like anxiety too.
Yes, it
contribute
can
that.
cause a lot of
Like you
anxiety.
feel like it's a little bit anxiety that you want to go, but
Yes.
every little thing that I have in my bladder, I feel like if I pee or sneeze or jump or
Okay, so that's enough.
that's fine.
So a tip I would give for people that, you know, when you feel like you're coughing or you're sneezing, that you are leaking, this is a quick, just like a small tip I would give. If you feel like you're about to cough, what I would say is before you cough, hold in the pelvic floor like a Kegel, or like a pelvic floor muscle contraction. Hold that and then cough.
I do that too.
Does it help?
Like I try to cross my legs. I do that too.
Do you feel like you're like holding,
It
trying to hold it,
helps.
and it helps?
Yeah.
Yes.
Yeah.
That's a quick tip I would give
Yeah.
someone that is having leakage, and which is called
Cross
stress
the legs
incontinence.
before.
Which is called stress incontinence. Of course, I don't know how tight your muscles are. I don't know what else is going on in your pelvic floor. But an easy tip I would give: do a quick Kegel and then sneeze and then cough. Yes, because no one should be walking around with pads. If you are not on your period, you should not be wearing a pad because you think you're gonna leak. You know, that's the goal. Of course, it's not everyone's different. It could be something else going on in the body. But in my head, you know, in a perfect world, no one's wearing a pad because no one's leaking. You know, we have some patients that change multiple pads because they're always leaking. So I always ask my patients, do you have to wear a pad? Because they're telling me yes, they have to wear a pad, that's letting me know it's a little bit more severe. Yes.
Okay, so I have a question. So if, for me, if I drink even a little bit, and now I've been drinking as I got older, I figure I need to drink more water. I can never drink it. Because as soon as I drink the water, I have to go to the bathroom. It might not be right that minute, but if I drink the water, I'm going to the bathroom. If
That's
I
why I
drink
drink
24 ounces, I'm going 3 times.
Wow.
There's no in between.
Yes.
So I don't know what, and you know, the Kegel things, I always heard about that, but I don't know if that, how do you kind of adjust drink, because you need the water.
Correct. Sorry.
But you don't want,
Yes. No, I would. The most important thing is to stay hydrated.
Yeah.
Because the hydration helps us. There's so many benefits to hydration: skin, bowels, bladder, all of it. So I would say, like, for you, if you feel like you have to pee, literally ask yourself, do I actually have to pee?
Sometimes
Because-
I do that.
Which is understandable. If you like, if you tried it about 2 times and you feel like, okay, I've held it twice, go to the bathroom.
Right.
Yes,
right.
because we don't want to hold the urine longer than it needs to. So the first time, do I really have to pee? Let me try to breathe. Let me relax. Let me tell the bladder, are you actually empty right now? And then hold it.
Okay.
And if you feel like it comes again, okay, do I really have to pee?
Right.
Okay, I can't hold it. Just go to the bathroom. At least try at least once or twice of trying to just breathe or asking yourself, do I really have to pee? And then go to the bathroom. Yeah. Let's see. Yes, this is a very, very functional topic. Everyone pees, everyone poops. So that's why it's a special topic to me, especially since in PT school we're only given like one slide of the pelvic floor muscles, and the professor looked at it and was like, this is the pelvic floor muscles, and he moved on. Mind you, there's so many muscles in the pelvic floor. We talked about just the layers, but there's different muscles within those layers as well. So I think it's a really important topic. I think, tell your friends, tell your family, like, hey, or even just being open and talking about it to other like colleagues and friends, so they know that you're going through it as well, helps kind of break down that wall and break down that barrier. So that's another tip I would give to talk to your female, even male friends. If you have open-minded male friends that are able to talk about it, talk to them about it, because men benefit from pelvic floor PT as well. I do not see men though, because I haven't taken that class yet. There's different levels when it comes to the pelvic floor classes. I would love to see men, and that's my goal this year, to be able to take that class and see men, but men struggle with it just as much as women do. Yeah. Any questions? That's all I have for you all today. Yes.
Thank you so much.
I feel like there is a mental component that comes
Yes.
with it. Like if you know you're going somewhere that doesn't have a bathroom,
Oh,
then
yes.
you're like, I don't know, you feel like you have to go constantly, even though you probably don't. Your bladder can be totally empty.
Correct.
How do you deal with that?
Yeah, I think is it constant? Because I have days like that too. I have days like that, like I was like, I'm just gonna bite the bullet, I'm gonna pee just in case, I know there won't be a bathroom. I even had a patient one time, he drove cars, he's like, there's no bathroom, I'm not gonna drink water, there's no bathroom. But it's sad because I want him to be hydrated.
Right.
He's coming in for headaches. Is he dizzy because he's dehydrated?
Right.
He's not drinking water because he doesn't have access to a bathroom. So I'd say it would depend. Like if it's one time that's like, okay, I'm gonna bite the bullet today, I know that there's no bathroom, I'm just gonna pee just in case, let me just go pee just in case. But if you're telling yourself, I know there will be a bathroom, and you kind of psych yourself out, I would say really talk to yourself like, okay, I'm fine, I'm calm, like nothing's going on right now, do I really have to pee? I would say that's the best advice I would give people. Like talk to your bladder, like, am I actually full? Did I just pee 30 minutes ago? Did I pee an hour ago? What did I just eat? What did I just drink specifically? Because if you're like, okay, because that happened to me literally the other day. I was with Sid. I use the bathroom like once every hour. Or like Sid, I think I had like an energy drink, and my bladder was just irritated. So I peed every hour. I just bit the bullet, and I was like, let me just go pee, because obviously my bladder's irritated. So there are some days that you just won't win. It's not every single day. It's not a perfect world, but it's is it once a week that you're having days like that? Is it once a month? As long as it's not every day that you're letting your bladder win. Don't let your bladder win. Don't let it win, because you have control over your bladder. Of course, when you come see a clinician, we go into more depth with what's going on. Is it stress? Is it key in the door syndrome? But I would say, like, literally try to just take control of your bladder. Yeah. Yes.
Specifically for urge incontinence.
Yes.
I learned about like when you have the urge that if you did like a couple of Kegels that like helps with the urge incontinence. I don't know if you learned that, but I
Yes.
thought that was kind of interesting.
Yes,
So,
correct. Because urge incontinence, like I said, so urge, running to the bathroom, I don't make it, I pee. Stress, I jump, I leak. So yes, just with urge incontinence, so you feel like you have to run to the bathroom, do a couple Kegels. I've had to do that myself too. Like, am I running to the bathroom because I actually need to pee, or is it because just I'm telling myself I have to pee? So Kegels works for that just as well, because at the end of the day, it's still leakage. And with leakage, like I said, it's because of, it's not supporting the bladder like it should be. So when you should do a Kegel, couple Kegels, like, okay. Then you're kind of taking your mind off the bladder. You're kind of distracting it, if that makes sense. Some people like to do deep breathing, some people like to think about something else instead of their bladder, so that they can take their mind off it so they don't pee. So yes, Kegels works for urge incontinence just as well.
So how do you, from a medical standpoint, from an insurance standpoint, is that something that, like, how do you tell your doctor or get your doctor to say, hey, I need this as a treatment?
Correct.
I guess that's what I'm trying to say.
So for me, I saw my GYN last month, and during the meet, I knew I wanted to go to pelvic floor PT because I knew I had muscle tension. So I forgot to tell her, but because I know the terms, maybe because she knows I was a physical therapist.
Right.
We didn't talk about anything P, but I texted her. I was like, hey, can I get a referral for urgent incontinence? Because I feel like I'm having signs and symptoms of urgent incontinence. I don't know if it's because she knew my background, she just gave me the referral.
Right.
But I would say, like, maybe just tell the doctor, hey, I want to see a pelvic floor PT. I think I'm having signs and symptoms of, like, not being able to hold my bladder. And then they should be able to give it to you, because anyone that's not able to hold their bladder, they should be in pelvic floor PT. They shouldn't be taking medications first. They shouldn't be going to surgery. Try the most conservative route first, and then look into medication, and then look into surgery. So I would just say, tell your doctor, like, hey, I want pelvic floor PT. I'm leaking.
Right.
I feel like that's clear in itself. Or I'm constipated. I need pelvic floor PT.
Right.
Instead of giving you medication to help you poop, why not pelvic floor PT first, and then we'll try the medication. So I would say any doctor that understands, but some doctors don't know what pelvic floor PT is too as well.
Right.
So you would probably have to educate them, like, hey, I went to a seminar, or I went to a class, or I've heard about pelvic floor PT and the benefits of it. I'm having these signs and symptoms, or this is what's going on. I would like a referral for pelvic floor PT, and it should be easy. But yeah, mine was super easy. Literally just gave her a message, and she gave me the referral. But
And not all insurances even require a referral.
correct.
Yeah.
Correct.
Oh,
It just depends on your insurance plan.
Insurance.
Depends on your interest. We could just come in through the door and see me.
Oh, okay.
Because as a physical therapist, because us that have a clinical doctor and physical therapist, anyone that should be able to walk, of course, every case is different.
Right.
Anyone that walks through the door, we should be able to see, are there any red flags? Do they need the emergency room, or do they need a medical doctor?
Right.
So that is why we did all the schooling, to understand if someone is, if they should be having PT, or they need something else that's going on. So once you see a physical therapist, you should be able to trust that clinician to be able to see you as a whole, and know that if something else is going on that I don't need PT, they would refer me out, or they make me talk to my doctor. Because that's what we learn in school. This patient need to be in PT, or they need to see someone else. So we would give you it would be a disservice if that clinician didn't refer you out when you needed to. But yes, anyone can walk in through the door and see a physical therapist. Any questions?
Good job.
Thank you all for coming.
Yeah.
I really appreciate you all coming.
Thank you.
Yes.
It's on the other side.